DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. Thanks for joining me. I'm Dr. Dan Thomson from Kansas State University, and today my guest is going to be Dr. Chris Blevins, who is an associate clinical professor and the head of Equine Field Services here at Kansas State University. We're going to talk about vaccine recommendation for horses for 2016. It's going to be great. Come back after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Welcome to the show.
Thank you.
Folks, this is Dr. Chris Blevins. He is the Associate Clinical Professor and Head of Equine Field Services here at Kansas State University's Veterinary Health Center. Good friend, good colleague, and I'm excited to have him on the show because we kind of do this update, try to do it whether it's annually or every 2 years. And we haven't done it for 2 years, but really we're going to do an update on equine vaccination recommendations for 2016.
Sound good.
And so kind of talk about where these come from and you know, there's lists from professional organizations, right?
Right, so the AAP, which is the American Association of Equine Practitioners, it's kind of the equine or horse board for veterinarians and recommendations and what they come up with specialists and research, what we should do for vaccinating our horse and when we should do it. And so that list comes through the AAP.
Okay. And so then they come out with two different groups of vaccines, right?
Yep.
And one's kind of you make sure you give this to everything, and the others are based on experience or geography, pandemic, epidemics,
right.
Veterinary experiences.
Right, right. And so the core vaccines are which, you know, every horse should get, no matter if they're even exposed to another horse, and that's probably a big thing to remember because, you know, I'll go to a farm and some people will be like, well, I don't see other horses, so why do we need to vaccinate? Well, you don't need exposure to other horses for the core vaccines, and they would be including West Nile, Eastern and Western equine encephalomyelitis, so that's the three of them there, tetanus, and rabies. And so those are considered every horse, no matter where they're located, should get those core vaccines.
Because they don't have to be exposed to a horse. They could be exposed to wildlife or to a vector of like a mosquito or something that might be transmitting the disease, carrying it from section to section.
That's right, yeah. So it's just based on the environment, right? And so you can't prevent a horse from being out in the environment. So
right.
That's why they get those vaccines.
Right. So then what are the other types of vaccines?
It can range a lot. Probably the big ones are influenza and herpes, which is called the rhino type vaccine. So those ones are ones based on risk, exposure to other horses, going to shows whether they would get those vaccines. There's equine viral arteritis is another one. Strangles
yep.
vaccine for horses is another one that some of them will go ahead and use. Potomac horse fever that depends on geographic location. Botulism for foals, we'll vaccinate those mares, but again, geographic location. Venezuelan equine encephalomyelitis, not necessarily kind of in the upper United States, but you get closer to Central America, and so a lot of Texas and those places, locations will put the V in with the rest of the vaccines.
So, you know, the cores, the veterinarian will come out, obviously on the rabies, the veterinarian's going to be taking care of that and being on the farm and maintaining records then. But how do you go about the deciding when you move away from core into some of the risk-based?
Yeah, and adding that to the core, it's one of those things where it's all dependent on discussion with the veterinarian. They need to decide what they're doing with the animal, the age of the animal, the breed, if it's pregnant, because there's risk of some of those vaccines and giving them too.
Gotcha. Well, let's take a break. When we come back, we're going to go into some of the when, why, how that we give some of these vaccines with Dr. Chris Blevins here from Kansas State University. You're watching Doc Talk. More after these messages.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Kevin Jock grew up on a 90-cow dairy farm in Livingston, New York. After the family farm was sold in 2006, he decided to become a large animal veterinarian. Kevin graduates in May of 2016 from Ohio State University, and soon after will begin his veterinary career at Country Road Veterinary Services of Apple Creek, Ohio.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Parasites will lose you more money than any other disease out there besides infertility. So, parasites is something that we have to control, and that's what VetGun does for us. It's tough out there on a ranch, but with the ease of the VetGun, it's a one-man operation, and whenever you can get one thing to work out great throughout that day, it just makes my life a little easier.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Chris Blevins. We're at Kansas State University, where Dr. Blevins is an associate clinical professor in the Department of Clinical Sciences, and he works to head up our Equine Field Services. And so he's seeing a lot of horses, doing a lot of this vaccination, teaching this to students. And so, one thing when we kind of left, not all vaccines are safe all the time, and there can be some negative impact of those. Let's go into kind of some of the negative effects of vaccines.
And I think that a lot of people, they need to consult with their veterinarian and not just grab vaccines just because they're available, and because some of those vaccines are a risk of even giving them. And one of them, just like for example, would be like a strangles vaccine, which is a bacteria. If it's a modified live, we squirt it in the nose. Well, if you put a bacteria in the muscle, you could cause an abscess, whether directly or indirectly. And so how you give that vaccine is very important. The other thing is they could react to the vaccine and get really sick. And so, they're not necessarily that we're based on your location and if there's a risk of getting the disease, but also the risk of the actual vaccine itself. The other thing is, what if the mare is pregnant? We have to be careful on what vaccine those mares get, because it could cause an abortion based on the vaccine itself. So anything, modified live in the horse, we have to be very careful and don't give those to pregnant mares, because that's a risk also.
You bet. Well, and you mentioned that strangles. I can remember that the location of where we would give it, because of the potential abscess formation of some of those vaccines, so that we wouldn't hinder the horse's ability to move. You know, when you start to think about this, and making sure you work with a veterinarian is vitally important.
Yeah, because that strangles vaccine, there could be that kind of bacterial extract where you give IM, and then there's the new one or the newer one you give in the nose, which is the actual bacteria, the weak one, and so you got to be careful not to give that one IM. So there's that confusion too. You have to make sure you deal with your veterinarian. Yeah,
absolutely, absolutely. So let's start out with, let's run through some different scenarios. So I have a foal. Okay, kind of when am I going to vaccinate the foal, and what's kind of your protocol?
Well, I think the biggest thing is to remember that foal, when it's first born, gets all its immunity from its mom in the colostrum or the first milk. And so I think that's something that they need to keep in mind. So making sure that mare is vaccinated 30 days prior to foaling, and then it gets in the colostrum. After that, 4 to 6 months is usually when we start vaccinating those foals and booster those vaccines in 1 month. And so that's something else that some owners forget. They give the first vaccine, but they don't booster in 30 days.
So we make sure that we get the mares 30 days prior to parturition. That'll give you the passive immunity and get you out there to 4 to 6 months. Then we're going to give our first vaccines then, and then booster in a month?
That is exactly right.
That's awesome. I mean, that just simplifies things for people when you're thinking that, you know, the mare, and what if they forget to vaccinate the mare?
You know, if they forget to vaccinate the mare, and if she hasn't ever been vaccinated before it got in the colostrum, then we might start a little earlier on the foal as far as vaccinating them. So you could even start out at 2 months or a month of age, depending on their risk and what they're getting exposed to, those kind of things. But again, because their immunity is starting to mature, we're going to have to keep boostering until they get about the 4 to 6 months of age before you'd stop boostering them. If you start early.
Well, I learned so much from different species. We may start doing some of this in beef. Anyway, folks, we're going to take a break. We're up against our time slot here. More with Dr. Blevins on equine vaccinations for 2016 after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
I'm Dr. Kip Lukasevich with Production Animal Consultation. Today's BQA tip of the day is proper storage of micronutrients. So today at the feed yard we're at, what we have here is we have our micro ingredients such as rumensin, our Thailand in the feed, our micro minerals such as Vela4 and so forth that are going to go into the micro machine. We just have to understand that when we store these ingredients is that we never store them next to insecticides or other chemicals that are not to be in the feed. These things have to be stored by themselves and in an area that is dry, temperature sensitive, and has humidity control as well. When we feed these things or put these things into the micro machine, just make sure from a safety standpoint that we utilize dust masks, gloves, so we don't get them on our skin, because sometimes they can be very sensitive, as well as just inhaling the product because they are very small in size and the dust can get into your lungs and so forth. So just use dust masks, use gloves, and then always store them properly.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and the wait is over. Enroflox 100 Enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease, with the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle. TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Chris Blevins, who's one of our specialists here at Kansas State University's College of Veterinary Medicine when it comes to equine veterinary medicine and equine practice. He's an associate clinical professor here in the Veterinary Health Center, and just a tremendous resource of information for us as veterinarians, and a great teacher to our students and providing service to clients around the greater Manhattan area. But when we're talking about vaccines, we've covered some of the foals. Let's get into the brood mares.
Yeah, and you know, I think the biggest thing to always remember about the mare is there's multiple things that's happening with her immune system and what we need to protect them for. You know, the brood mare, the mare prior to getting pregnant, we need to protect them from certain diseases. There's some viruses that could even be in the semen from that stallion, cooled or frozen, so if that's the case, we need to make sure she gets vaccinated for that. It's called equine viral arteritis, so it's one of those viruses we use prior to breeding. And then the other thing is making sure that we don't have anything that's going to cause an abortion. So staying away from all those modified lives. We just don't have any of those for the mare when she's pregnant and
that
just
are
not
safe.
to use. Yeah, so making sure that it's safe for her during that aspect.
So no modified lives in pregnant mares?
Correct.
Gotcha.
We just don't have that right now. Maybe later on there'll be some research and we'll have one that might be safe, but we do not have one for the mare.
Great. So then when we come up there that 30 days prior to parturition or prior to giving birth, what are you recommending?
Yeah, the biggest recommendation is all the core vaccines that are all killed, and to do those 30 days prior to foaling. You could, though, they found, give the rabies vaccine prior to even breeding. The immune response is still good to get in the colostrum in the 11 months and still would be fine. But the core vaccines, so the Eastern, Western, West Nile, tetanus, rabies, and then, you know, if the other potential risk, you could always add other ones like influenza, herpes vaccines, strangles vaccines. Depends on, again, the aspects of risk of the other ones.
So, and that's the flu rhino, right?
Yep.
Okay. So let's go. You know, I think there's some of these other horses. You know, let's take the ones that are not bred, and we may not get through all this before the break, but your geldings and your workhorses, when are you vaccinating those?
You know, and that's a good point. It just reminded me that even on that brood mare at 5, 7, and 9 months of gestation, there's a rhino vaccine, or the herpes vaccine we give them so they don't abort too.
Gotcha.
I just remembered on that one too. But yeah, no, the rest of them, it's the core vaccines, and then going to shows. Where are you going to shows and what we need to protect them from? So the rhino flu is actually one of those that we do use a lot. But then also, you know, maybe they're going to a region where Potomac horse fever is something that they're worried about, so we'll add that. Maybe a Venezuelan, so down south. So depends on where they're at and where they're going.
Core vaccines given once a year?
Core vaccines given once a year. If you live in the southern United States, sometimes they have to booster those core vaccines also in the fall. Most vaccines are prior to the mosquito season in the spring, but if you have a mosquito season that's pretty long, got a booster also in the fall.
Cool. Folks, we're going to come back with our wrap-up section on vaccines for equine with Dr. Chris Blevins. Thanks for watching Doc Talk today. We'll be back after these messages.
That's My Breed, brought to you by Premium Sourced Cattle. Learn more at toolcattle.com. The Sim Angus breed was created in the late 20th century in response for a demand for a crossbred animal combining the superior qualities of the Simmental with Angus or Red Angus. Very popular as a means of producing cattle with high performance and high market acceptance levels. The Sim Angus breed combines the best traits of both parent breeds. Bulls are bred to calve easy and increase quality in pounds without sacrificing cow herd efficiency. Females exhibit excellent fertility and milking ability and produce calves that have excellent carcass quality, high meat yield, and meat quality. The added hybrid vigor produces healthy calves that grow faster and replacement females with increased longevity to produce many calves during their lifespan. A registered Sim Angus animal comprises between 1/8 to 7/8 Simmental and 1/8 to 7/8 Angus or Red Angus. Breeders choose the percentage breed mix to suit their own herds and the markets they supply. Nestled in the sand hills of Colorado, Premium Sourced Cattle has built a business based on supplying proven, hard-working Sim Angus genetics that add value to their customers' bottom line. Committed to using all the available technologies available, they are offering up bulls that will cover more cows and maintain their flesh and soundness better than most yearlings in the country. Join them on Wednesday, March 23rd for the 4th annual Bull and Female Sale. See total offering at www.toolcattle.com.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Chris Blevins, who is an associate clinical professor and head of our Equine Field Services here at the Veterinary Health Center in the College of Veterinary Medicine at Kansas State University. He's a friend, he's a colleague, great teacher and great practitioner. Glad to be able to go to work every day with him. We're talking about vaccines in equine, and we got through all the different, but let's go back to kind of the show horses, because you know, how do I find out? Do I get hold of my veterinarian? You know, if I'm going to go to Denver, or if I'm going to go up to Minnesota or somewhere, how do I find out what would be recommended?
You know, first of all, I think you should start with your veterinarian and figure out that discussion, where you're going, location, because they'll give you great information on that too. The other thing is some of the shows are actually requiring certain vaccines, and so that may be falling more on that owner to make sure they go to the list based on the show. And so what are the requirements for that show, making sure they have everything properly documented, which the veterinarian can also help with that too. What vaccine was given, when it was given. Sometimes they wouldn't even know the information of serial number and expiration of that vaccine for those shows too.
Wow.
So they want to know all those information. So again, that would help with that, consulting with your veterinarian, but also checking on some of the shows, because there's getting to be more and more requirements.
Yep, and if you're going there, they're not doing it to be exclusive. They're doing it to protect your horse, and they're doing it to protect the horses within your region, because if you go up there and pick something up, next thing you know, you've brought that home.
Yeah, and I think that's something that we're starting to see more and more is, especially even like the neurologic herpes is kind of the biggest thing, you know, that's out in the news right now. And we don't necessarily have a vaccine for it, but there is some things that we can do, requirements and those things to try to prevent some of those kind of wildfires from getting started at the shows.
We talked a little bit about giving vaccines, you know, prior to the mosquito season. You know, the spring, January is not spring, right?
Well, it's not spring here in Kansas, but you know, is there a possibility where it could warm up further in the southern United States, and maybe they start their spring shots February, early March? But you know, that's something too. You have to consult with your veterinarian, see when the best time to start those vaccines, and go from there.
Great. Thanks for being on the show.
Thank you.
And thank you for watching DocTalk. If you want to know more about what we do, you can find us on the web at www.doctalktv.com. Remember to always work with your local veterinarian. Thanks for watching DocTalk today. I'm Dr. Dan Thomson, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.